There are a lot of people in this chamber today and even more watching. And I would certainly be remiss if I didn't take this opportunity to update you on Louisiana's response to COVID-19, the novel coronavirus. Just minutes ago, while I was on a conference call with Vice President Mike Pence about the coronavirus, I learned that we have a presumptive positive case here in Louisiana, a Jefferson Parish resident who is hospitalized in Orleans Parish. It still has to be confirmed by the Centers for Disease Control and Prevention. Understand, however, that we are treating this as a positive case, and this confirmation process will not slow us down from taking any necessary actions to continue monitoring and preventing the spread of this virus. I have promised that we would be transparent about this, and we will. Later this afternoon, I will be joined by public health officials for a news conference to answer questions. Now, together, all of us, as a government, healthcare systems, providers, schools, businesses, neighbors, we must take action and be vigilant to prevent the spread of this virus in our great state. Now is the time for seriousness. There is no place for panic or hysteria. The novel coronavirus and preventing the spread of illness has been an increased focus over the past weeks and months as we see more cases pop up all over the country. In response, I launched a task force that is leading the planning effort for different scenarios involving COVID-19, and our state agencies have been coordinating with the federal government and with each other to ensure that we are preparing for and responding to this public health threat appropriately. As legislators, one of the most important things you can do to help is to share accurate information with your constituents about the current threat in Louisiana, which still remains low, and the proper way to avoid spreading illness, including hand washing, coughing into your elbow, avoiding unnecessary handshaking and physical contact, and certainly staying home when you are sick. One of the biggest questions that people have across the country is about testing. In Louisiana, we've completed 15 tests so far at the state's public health lab. 14 are negative, and 1 is positive, as I just mentioned. We've recently received 2 additional test kits from the CDC and have the capacity for several hundred tests. For our tests, we're working within the CDC's guidelines to test 3 groups of people: those who have traveled to certain areas and have symptoms, those who have had close contact with a person confirmed to have COVID-19 and show their own symptoms, and finally, those with an acute respiratory illness that cannot be explained. While we in most states had limited testing capacity at the start of this process, we should see commercial testing go live across the country and here in Louisiana this week. Commercial testing means that more people who are sick will be able to talk to their health care providers about their risk and if they need to be tested, and that is certainly a good thing. Our role at the state will be to take any test that is presumed positive by a commercial lab and then to verify it at the state public health lab before sending it to the CDC for confirmation. This verification will be very important as these commercial tests come online. Let me be clear. We will immediately take action on any positive test out of an abundance of caution while waiting for confirmation from the CDC. And yes, we will still be announcing any additional presumptively positive cases to the public. For anyone who is presumed positive, we will also be completing what epidemiologists call contact tracing to make sure we are assessing the risk to the people who have come into contact with them and completing additional testing to prevent the spread. We do encourage anyone who is sick to seek advice from a medical provider. We also strongly recommend people avoid going out in public if they are sick. Regardless of if a person has the coronavirus or the flu, we must all be vigilant to prevent the spread of illness in our communities. You know, there are many things that I love about Louisiana, but our ability to work together when times are tough is certainly at the top of the list. I am confident in the men and women who are working each and every day to prevent the spread of this illness. I am grateful for anyone who plays a role in this response, and I'm praying for the health and safety of the people of Louisiana, and I encourage you to join me by lifting up your own prayers.